But joining me now, Dr. Elizabeth Whelan, president and founder of the non-governmental nonprofit American Council on Science and Health. She believes much of the concern over environmental toxins really doesn't have a basis in reality. Also here is Ken Cook, director of the Environmental Working Group, a nonprofit research and lobbying group. He says the government regulation of chemicals has not gone nearly far enough. Thanks to both of you for joining us.
Thanks for having me.
You know, it's interesting. Dr. Whelan, let me start with you. You said you want to clear up some misconceptions about the association between environmental toxins and children's health. What are some of those misconceptions? Do you believe that they can be harmful?
First of all, there's a major gap between what people perceive about chemicals and health versus what the scientific reality is. You know, we are surrounded by chemicals, mainly from nature. Everything is chemicals, and we have to accept that. I know of no case where an unborn child, a child or an adult has ever suffered health consequences from exposure to trace levels of chemicals. I feel this is all a distraction. We want parents to worry about the real threats to their children. Things like wearing seatbelts, getting a smoke detector, getting vaccinations. You know the drill. Instead, they're worrying about whether they can use plastic bottles or microwave or whether the shower curtain is dangerous. And this has become absurd. I think we have to bring more science back into the dialogue.
Ken, what do you think about that? I mean, that's part of what your organization does, is try to bring some science into this.
Well, I mean, I think the problem with Dr. Whelan's thesis is that scientists themselves don't agree with it. We have a national toxicology program that's devoted to looking at levels of carcinogens that we find in everyday life. It's not all occupational, and yet we have health risks. The Environmental Protection Agency regulates hundreds and hundreds of pesticides. Again, these occur at very low doses, and time and again they have taken action when they felt that there was a risk to particularly children. So it seems to me that the real issue here is not that we have to say either or. I don't think we're telling parents when we say they should be concerned about pollution in the environment that they should take off the seatbelts or stop putting on helmets when the kids go for a bike ride or start smoking.
It's a matter of priorities. This upsets our priorities. Are we talking about government agencies? Well, let's say the National Cancer Institute is on record as saying that they know of no ill health related to the approved, regulated use of pesticides. They've spoken. The Food and Drug Administration gave a statement, a very clear statement in January about the chemical BPA, which is used in plastics. It's used in can liners to prevent foodborne illness. Everyone's worried about it. They shouldn't be. Well, the FDA has spoken and said it's safe.
Dr. Whelan, I mean, the reality is, though, as you know, there are 80,000 chemicals out there that we're talking about specifically here, of which 200 have been tested. So the point, I think the point that a lot of people get concerned about, not so much that we think that they're dangerous, but we don't know that they're safe. You don't know it. And we've made these mistakes before. I mean, we used to think lead was okay. And now we know that not only is it not okay, it can cause significant problems.
The problem is how you prove something safe. It cannot be done. It's like proving a negative. And you take something, like, again, a chemical like BPA that's been around for 50 years, been tested all over the world, and everyone says it's safe, yet it still does not have a safe designation in the minds of many people who are concerned about chemicals.
Well, it also doesn't have a safe designation entirely yet from the U.S. government. The Food and Drug Administration is still examining bisphenol A. It's a common ingredient in can liners and other sources of environmental exposure. The Environmental Protection Agency has listed BPA as one of its chemicals of concern, so it's just not the case. But you do make a good point, well, Dr. Gupta. You know, there was a time when the tobacco industry said that cigarette smoking was not a problem. In fact, they denied it way into the era when science was saying otherwise. So I think Dr. Whelan, she has a lot of support from the industry. I think making the points that she's making is the kind of thing that is reassuring to some chemical companies. But the final verdict really is, what are the chemical companies saying themselves now? And what they're saying is, we think we need reform.
All right, Dr. Whelan, go ahead.
I must jump in here. We do not have a lot of funding from these chemical companies. As a matter of fact, we represent ourselves as an independent group representing consumers. And to bring up any analogy with the tobacco industry, it is absolutely intolerable. There is no comparison. We had epidemiological evidence starting back in the 50s that cigarette smoking caused lung cancer and other diseases, and the industry did deny it. And it was a terribly irresponsible thing to do. What we're talking about here is a absolute distance from the tobacco industry. There is no evidence that these chemicals, as used, pose any ill health. And I think we have to, again, go back to the natural chemicals and say, why aren't we worrying about them? And you mentioned that we can find chemicals in the blood of the fetus or the embryo of the mother.
The umbilical cord.
Well, you know, we can find anything in anything with our analytical techniques today. So the fact that you can find it has no relationship to it causing any ill health.
Well, I think that's actually a fair statement. My training's in chemistry. I don't think anyone should make the case that just because you find a mixture of chemicals or individual chemicals in someone's blood that it is a health risk, but I don't know anyone who's making that claim. What we're saying is if you're finding chemicals in umbilical cord blood, we ought to have a very rigorous way of determining whether or not they're safe.
It does still strike me, I think, just as a father more than anything else, that we don't know the answer to some of these things. And out of those 80,000 chemicals, only about 200 have been tested. I really just have a hard time still getting my mind around that. We'll have you both back.
Thank you, sir.
Stay tuned.